all have had patients who have lateral epicondylitis or tennis elbow. And one of the characteristics of lateral epicondylitis is morning stiffness. They may even present to your clinic walking with their one arm that's symptomatic like this, and they're doing most everything they can in this range because it hurts so extensively when they reach, as we know, doing anything in this aspect, even as much as grabbing a cup of coffee or a cup of water or whatever. So they tend to do everything in this mode, which can also be not only bad for the elbow, which could cause a stiffness, which is what they're starting to get. You could also risk a frozen shoulder. But let's just look at the morning stiffness with the elbow. Most of the patients will complain of morning AM stiffness. So you want to help them. One way to do it is have them recommend that they go into the shower and have them just run water on it for a while. That heat is very effective. Another thing that's extremely effective to help elongate some of the tissues is stretch and heat. So to get in the clinic, obviously the hot pack, and then you would put the heat on the elbow portion, because that's the stiff portion, and then you want your weight, your stretch, and that would be your heat and stretch. So if they're stiff to this degree, make sure that the platform that your arm isn't going to limit the elbow from extending. But you can either put a hand weight in the hand or a wrist cuff and allow the heat to do its job as well as the weight. So for more comfort, you may want to use like a wrist cuff as well. But this would be very gentle, nice, help to elongate the tissues, make it more tissue extensibility, and then following the heat and stretch, you can actually have them do some very nice, gentle range of motion exercises. Another thing that you want to incorporate into a home program is a nerve gliding exercise, because pain in the elbow may be contributed also due to the tension in the neck, and you can do some neural stretching. So, which in conjunction with the rest of your home program, massage and therapy, can be another aspect that can help with tennis elbow. And the nerve glide we're going to do is just have your arm to the side, wrist with palm open, and then watch the head, because the head is just going to rotate, and then I'm going to actually look down to the ground. Nice, nice stretch. So again, start position, end position, start position, end position. You can hold these stretches for, anywhere from 4 to 10 seconds, depending on the comfort level. Now let's look at some wrist extension exercises. So wrist extension, let's look at eccentric and concentric exercises. You'll get a weight in the hand. This is a 2 pound. You can start with a 1 pound. You're going to pronate the arm, palm facing down. Support the arm either over the edge of a table, or you can even use your knee, whichever is convenient for you or the patient. And you're going to raise the wrist, extend the wrist slowly, and then slowly bring the wrist down. Okay, slowly. That's your eccentric, and this is your concentric. So raise the wrist up slowly, concentric contraction, and lower it slowly, which would be your eccentric contraction. Then, of course, we can do it the opposite way. For the flexors too, start with it in the extended position, slowly, and then slowly down. So the key is also trying to get that resistance when you're doing the eccentric. Some people even do them where you'll actually bring the wrist back and then go down into that eccentric contraction. Other times you can do it even with your wrist pronated, and it's the same thing as taking it back and then resistance with a TheraBand or something. So there's different ways to do those eccentric contractions. And now another thing I'd like to look at is just the bar exercise. The last tip that I'm going to discuss in the lateral epicondylitis or tennis elbow treatment tips is going to be on the strengthening part, or even another form of what we call eccentric exercises. We've all heard of, using the bar and you put a weight at the bottom. And again, some therapists like this a lot, some don't because they feel it's actually too aggressive. Every clinician has their own tweaks to what programs they have. But this was one aspect that you can do. Obviously, this would not be done until you have increased the strength in the extensor. So this may be the last portion of a home program or the last portion of your clinical rehab. Another thing or a buzz that you hear about is using some type of rubber bar. It could be anything that actually can just have a little bit of pliability, just like that was the hard stick, You can take something like this. You're going to go like this, and then there's different ways. You can actually start to do some motions like this, and even getting the motions like this. There's actually some therapists that are even proposing specific exercises and calling it isolated eccentric exercises. I think it's hard to get true isolated eccentric exercises regardless what you're using. But this is something that you're seeing a lot of. There's been a lot of buzz on this, good marketing on the product. And there is some benefit to it. Again, that's a clinical decision. It's just a tip that is out there, just like with the bar. I personally don't use the bar a lot. I have my own exercises that I use. I have not used the rubber bar either on a lot of patients. However, it is something that is a nice tip and something that you can look into. Okay, so we have just loaded you with a lot of different tips ranging from heat and stretch all the way to strengthening and eccentric exercises. Exploring Hand Therapy Treatment to Go offers you great courses and reference material, and this is one of them. This is our quick reference treatment guide to lateral epicondylitis. It is a 14-page booklet that is great for a home program exercises, loaded with all different types of tips. We also have lateral epicondylitis tips, tricks, and trivia course, as well as a full-length lateral epicondylitis course. So please visit handtherapy.com and view the many opportunities we have to help you successfully treat lateral epicondylitis.